There, guys. I wanted to share with you today a little bit about your dashboard. So once you have logged into policyholder portal, I'm going to show you real quick. I wanted to be there for you. So under neweralife.com, you have policyholders. And if you haven't registered already, you'll want to go through the registration. You're going to create a user and a password that you'll remember. They will send you a confirmation to your email, and then once you get that, you'll click on it and you'll be able to log in, and then you'll go into the policyholder login. So I've already done that on mine. I'm going to just show you some of the top most used areas that are important for you to know. First of all, you're going to see the dashboard, which is, where you're going to see all of the most common things that you're going to use. There's also a navigation over to the left that has many of the same things. It's got a few that you don't have in the middle here. But again, this will give you access to your policy benefits. You can click on your benefits and then you can click into the policy benefit sheet. And if you forget, oh, what is my chiropractic benefit? You can see that the chiropractic benefit is in here. Or if you don't want to do that, you can text me and I can typically tell you what your benefit is pretty quickly. But if I'm not available and you want to look and see, these are not inclusive, but this is the most common benefits in your plan. If you want to know ideally what benefit is, you can email the claims department and ask them, and they will let you know exactly what your benefit is based on your plan. That is typically the easiest way. So if I'm out of town or can't answer you right away, it might be a good option. Online payment is if you need to go in here and make an authorization for a payment, you need to change a bank draft authorization so your checking account changes. You don't want it coming out of the certain account that you have anymore. You can complete the bank draft authorization and then you'll basically send it to policyholder services. You don't need to copy me on that. EOB, claim EOBs is where you're going to find anything that you have either paid cash for and submitted a claim, or that your doctors or the facility has filed a claim. So when you file claims, you're either or, you're not both. You're either going to be self-pay or you're going to file with the insurance. So you either use your card or you don't use your card and you're self-pay. And if you're self-pay, then you want to submit that claim. And I'm going to show you how to do that. But once you've submitted the claim, then you can go into your claims EOBs and you can see them there. If you have confusion on what the EOB is telling you, then you can send that EOB to me. I do not have access to anybody's EOBs. It is HIPAA protected data, and they're very particular about that. So if you want me to take a look at an EOB for something they've either rejected or you don't think they've paid correctly, send it to me so that we can challenge it and we can talk to the claims department on your behalf. ID cards is just as it says. If you lose your ID card, need a new ID card, want to print one out for your kids to have in their backpack, you can print that out. Just remember that that ID card really is your choice to be either self-pay or go through the insurance. You have that choice. Some facilities will tell you that if you have insurance, you have to file through the insurance, and that is not true. You actually, with an indemnity plan, have the choice of either being self-pay or paying through the insurance. Bills is going to be just in any premium bill information that you have. You'd click on that and it would give you that information. Quick request is going to be probably the most commonly used outside of the New Era telehealth. So when you click on quick request, you're going to pick the policy and then the activity or the request that you're going to do. There's bank authorization, so you could upload that bank form securely to the company so that they can fix the account or change the account that you have currently billing, EFT. Electronic funds transfer. You can do a claims inquiry. So if you get an EOB and it doesn't look like they paid it correctly and you don't want to get me involved, then you can get them involved and ask them why they didn't pay a claim, or if you think it's been paid incorrectly, you can ask them about that. If there's any additional documentation requested, you can upload that securely here in your portal. If you have a new claims, you'll use this button. If it's general, you'll use this button. If you have a policy change, you're dropping a child, you're adding a child, adding a spouse. Typically, you want to get me involved, but you can upload that here so it's secure. And then if you wanted to invite a doctor into the network, you can use the provider nomination form. So the claims new claim is probably what you're going to use the most. And you'll want to go ahead and select the patient. And then if it's a prescription claim, you'll click this. If it's not, then what you'll want to do is go to your common forms. You'll want to download the appropriate policy document. This is only for your first year. So under your first year, you will have to file a claim form. It's very, very easy to complete. So you'll complete the policy form. If you have gold, it'll be HSP gold, and then you'll just complete that information. It'll ask for all of the basic information of the policy owner, which is the primary person on the policy. And then if you have your children on there, your spouse on there, then you'll list them out with the event. And it's box 10, 11, and 12 that you'll need to complete and update based on the actual event. So what I usually will tell people to do is to create the template, download the form, update the information with your social or the policy owner's information, and then keep that form named as your template. And then when you have a claim, you can pull that form up, update box 10, 11, and 12, any other pertinent information that might need to be updated in there, and then save that with that date, and then you'll upload that. So it's that easy. When you have a claim for a prescription, you have two ways of doing that. You can either take this form that you got from the pharmacist that they staple to the bag, or if you go into whatever your pharmacy portal is and you download the list of any prescriptions that you've had filled, then you can upload that form as well. You do not need a claim form for prescriptions, or at least the last time I checked. That is subject to change at any time. But just remember that any prescriptions that you have been prescribed in your first year would not be paid for the first year. You only get that benefit in the second year. New Era Telehealth. Man, this thing is fabulous. So you will click on this. These are free visits. So, if it gets to be the weekend or you can't get into an urgent care facility, you're traveling, not feeling well, whatever it is, you can use this virtual urgent care. You'll click on this and you'll fill out the pertinent information on it. It is free. It doesn't count against your doctor's visits. You'll pick the person that it's for, and then you'll go through kind of the information. I haven't actually used mine yet on this app. And then you also have psychologist benefits. So if you don't want to use up your doctor visit benefits, you can use this psychologist or counseling benefits, and it's unlimited. And so it doesn't count against your doctor visits that you have unless you want to submit those for reimbursement. Otherwise, it's $100 per visit. Most counselors don't accept insurance, or if they do, they're very limited. So you can always use these services if you or your family members need them. So it's a great, great, great service to use. Dashboard is always my home key. Fair pricing tool is just a cool tool that if you ever wanted to know what gallbladder surgery in your area or knee surgery or appendectomy or hysterectomy or whatever it is, it's going to give you the cost or the average cost in your area for that type of procedure. So it's a pretty cool tool. And then if you want to search providers or you want to search your network, you're going to pick your indemnity plan, and then it's going to pull up to this. You hit start. And again, remember that New Era Philadelphia is who underwrites the plan, and First Health is your actual network. So then you're going to click physician. I typically recommend accepting new patients. You'll put in your area and then you'll hit search. If you want to look for a particular doctor in network, you click this little plus button, and then you're going to put in the last name of the doctor. If you've selected the right zip code, or if you don't know the zip code, you can find the zip code, or you can just increase your radius to be able to find them. Typically, if they're in network, it will auto-populate, but not always. Sometimes the physician is going to be under the physician. Sometimes it's going to be under the facility. And so you can search it both ways, but I would put one in, not both, and then that will ensure the proper search. Just keep in mind that sometimes doctors, it's very fluid. Doctors come in and out of network. That's the beauty in this plan, is that you'll always have a benefit, whether it's in network or out of network. So you don't have to worry about that. This function down here is pretty cool. If you're looking for a particular specialty, like if you wanted to find a dermatologist in your area, you could click down here and you could pick dermatology and add it over here and then hit search, and it's going to provide you with all of the dermatologist in the search area that you requested. Many times you will find that there are duplicates because they're going to list every doctor that's under that facility that's in the network. And again, let me reiterate that you can go and see anybody in or out of network. But if you're paying cash, you don't give them your card. And if you give them your card, you don't pay cash. So it's one or the other, just remember. Again, if they come up in this list, it's a pretty good shot that they're in network, but not always. There is a cool tool radio button over here that if you wanted to create a bunch of doctors that you like to go to, you can create your own little list. And then down here, you can view your list and it's going to show you the doctor that I just picked. Show you that real quick. So there's that doctor that I just picked. And then I can create my own directory. I can compare whatever you want to do. One of the other tools that I wanted to show you is this valuable member benefit. If you're looking on a cell phone, you might not see this quick tool guide over here. So I encourage you to go on a desktop, but the valuable member benefits, if you click on that, it's going to show you again the telehealth that's already in your dashboard. It gives you script save, Wellx, which is a discount drug plan that you have access to. I did do a search the other day and actually found a medication cheaper through script save than I was finding it through GoodRx. So you might want to search both places. There's so many options today that you just want to choose the one that's best for you. But I always ask my pharmacist, is that with my GoodRx discount? And if they find a better one, they're typically going to give me that because I've been doing business with them for a long time. Healthcare Pals is just a phenomenal service that you have in your plan. You can call them before you're receiving care. They can help you to shop. They can help you if you have a big incident going on. They can just help you to navigate anything about your plan. So they are phenomenal. They're Johnny on the spot with answers too. But you can always call me as well. But if I'm not available, this is certainly a resource that you have. Bill negotiation services, you have this built in, but you also have that through us. So if you do have a situation or an issue with a bill that you need negotiated, you can utilize our services, and those are free, so you might as well use them. You typically, in this situation, whoever's going to do it is going to require approval from the facility for them to speak on your behalf. They might accept a HIPAA form, but typically we find that if you want somebody to negotiate on your behalf, they typically will do a three-way call, and then you're giving them permission to negotiate on your behalf. That doesn't happen very often, but it could, especially emergency room visits or something like that. Coral Bundle Care is a game changer. So if you are ever having something done, whether it's a mammogram, an MRI, CT scan, knee surgery, you want to go have gallbladder surgery or whatever it is, Coral is your go-to place. You're going to put in whatever it is that you're needing to have done, colonoscopy or mammogram, and then they're going to find the facility in your area of your choosing. And then once that happens, they will then tell you what the cost of that procedure is. And then they're going to coordinate that with the insurance company. But you have to fill out this form, and then they'll reach out to you and kind of tell you what the next steps are. But I've had some great success stories with people utilizing Coral, people who have had very, very affordable things happen, like colonoscopies have been coordinated with Coral through Coral at the facility, and then the insurance company is paying that bundled price, and then you pay the difference. I've had somebody that had a hysterectomy that was very affordable. Again, as affordable as healthcare can be today, they try to make it as easy as possible. So that's really most of the things that you guys are going to use. There's a lot of tools out here that I would encourage you to check out in your free time, but it's all pretty much usually right here. So if you have questions about your benefits, it's here in your policy benefit document. But if you don't understand any part of that, or you don't have the time and you just have a quick answer, feel free to text me or email me. I'm happy to help you navigate this and understand your plan better so that you can get the most out of your plan. Have a great day.